Wellness for Life, we are concerned about the entire whole of you from the inside out. And today we're going to talk about some of the outside. So, skin resurfacing. So, what is skin resurfacing? So, essentially, we have several layers of our skin, and the outside one, the epidermis, is the one that's exposed to the world. And so, this one takes a lot of beating. So, the sun, chemicals, products that you might put on, things that are in the water, wind, so many different things. Dry that surface out, make it kind of like a dry, crispy surface on the tender skin that's underneath. And that may not give you the exact look that you're liking. So, what that will do is create some fine lines and wrinkles, flaky, uneven skin. Also, you could have some discoloration in places, maybe some browning from the sun, and not like in a glowy tan, but in different spots across your face, or even some sunspots. People with melasma will usually notice if they've been in the sun that they're going to have, pretty much a really defined look of being in the sun that they might not enjoy. And so skin resurfacing goes and starts bringing some of that fresh new skin up. As we age, our skin does not turn over as fast as it used to. Baby skin turns over boom, boom, boom. That's why they've got that fresh, dewy skin that we all love. As we age, it can get up to every 90 days your skin is turning over. And so if you think about it, if you had a piece of cloth outside for 90 days on your balcony waving in the wind, after 3 months, it would look pretty dirty, tired, just not like the flag it used to be. And that's the same with your skin. So to resurface, then we are getting rid of some of that dead stuff on the outside, bringing up the fresh stuff, and encouraging that to continue to happen. So we have a lot of different ways of skin resurfacing. And so we're going to start with the more mild and work our way up. And so some of the more mild things we're going to do are some facials with exfoliating. So we use Zeo product, which is medical grade. You can only buy it at a place with a licensed provider because it is so corrective. And so the exfoliants are absolutely amazing at creating a nice, fresh skin turnover, but it's going to be very subtle. And these are things that you could use yourself at home, once or twice a week, as well as like a retinol that you could use at night. Again, you could use this, a couple times a week, up to 5 nights a week if you're getting ready for a peel, which is the next thing we're going to talk about. So we have two separate peels here, and a peel is exactly what it sounds like. We are peeling off a lot of that dead layer and letting the fresh skin come through. We have two different peels here. So they are both Zeo. We have the stimulator peel, and that one is the lunchtime peel. So you're going to see refreshed, happy skin after this one. It's not very spicy. And the thing is, a lot of times with peel, people want to see after. They want to see their skin peeling after. And that's not always what happens. Is during the peel, that skin is leaving. You're not seeing it though, because you're lying on the table enjoying yourself. And the stimulator peel, for the most part, is going to be like that, unless you have some, pretty impaired skin barrier, which will present itself as sensitive skin. And then in that case, you might actually see some after peel skin sloughing. But nonetheless, that's going to give you a really good, nice, easy peel. Then after that, we've got the 3-step peel, and that one is also from Zeo. That one is very corrective, and also I'm going to say very spicy. But oh my gosh, amazing. So with that one, we are going to have to skin prep, which means you're going to have to be using retinol for the weeks preparing up to this to get your skin ready for this peel. Then the peel is applied in a 3-step process. It is done at one time, though you don't have to come back 3 times. And then after that, you are going to have some skin sloughing off over the next 3 to 7 days. And this can be fairly dramatic. When I did it, I felt like I had leaves rustling off my face. My skin was definitely moving along, but underneath is, oh my gosh, fresh, dewy, amazing skin. So this is one, if you're really wanting to do some correction, you're really wanting to make a change in your skin tone and appearance, you're going to want to go for this 3-step peel. But do be aware that for the next week, you're not going to want to go to any event where you think you might be photographed, or you're really just wanting to have like a smooth face, because that is not going to be in the cards for you that week. But the week after, you don't even need that makeup. So, and then other things we can do, moving outside of the aesthetics room and into more of the aesthetics. And so with that, we have a couple different options. So one of them is AquaGold. So AquaGold is a microchanneling device, and it has, let me see if I can get one of these out here. They're amazing. So these are little devices that in this chamber, I can put a lot of things in there. So I put hyaluronic acid, B12, I can put PRP, which is stem cells. We could do a little bit of filler. I could put some insulin in there to encourage skin growth and renewal. So many things I can put in there. And then this, if you can see the little gold microchannels. So that's what it does, and that's why it's called AquaGold, because it's 24 karat gold, and it essentially stamps into your skin. And so while it's stamping in, the product that I put in the container is going into your skin in these little microchannels. So this one is not painful. You do not need to be numb for it. There is no downtime after. Depending on what I put in it is really kind of depending on what you're looking for and how much correction you're wanting. Obviously, the more intense products I put in it, the more intense the response is going to be. But again, I don't know of anybody that's really going to have downtime with this, but you are going to notice a glowy plumpness that is simply amazing. And then moving on from there, we can do actual microneedling. So this is our microneedling device. It does not have the needles on it because that's sterile, and I didn't want to get those guys out. But there are needles that fit in here. And then so what happens is we use hyaluronic acid, put it all over the face. You are numb for this. It is not the most comfortable of things if you weren't numb. Once you're numb, it's great. And then with that, I'm making little small movements with those needles, and I'm looking to create little micro wounds in your skin. So this is the vampire facial, and it's called that because as I'm circling around and creating those wounds, you do get bloody, but that's fine, because that causes so much growth factor to get called into your skin to give you that plump, collagen enriched, luminous, glowing skin. So we go over your whole face. Afterwards, depending on what it is you like, we can draw off your stem cells, use that as a serum, and we'll send the rest of it home with you. We do this in a series of 3. So every month you would come in and get this at the end of the 3rd month, so into the 4th month, then you would see a huge change in your skin. So all of these things are best when you're not going to be out in the sun. Some of them are okay for, just quick, like our lunchtime peel, AquaGold, things like that you could still do in the summer. But things like microneedling, the 3-step peel, all of that, you probably want to wait until you're going to be inside for the most part. And then to get the ultimate in skin resurfacing, absolutely amazing, we're going to be doing the microneedling. And then 2 weeks later, we're going to be following that with the Zeo stimulator peel. And then 2 weeks later, another microneedling with stem cells, the vampire facial, and then another 2 weeks to peel. And we do that 3 times. And that will give you just phenomenal, glowing, absolutely amazing skin. And then at home, you are still doing your work with, hyaluronic acid, with your Zeo products. You're getting your facials every 6 weeks. If you do that and we do this, you will get the results that you are looking for. Let me know if you've tried any of these things, if you have questions about them, how your experience was. I always love to hear different ideas that people have. If you've done something that was like slightly different, but in this realm, and you want me to know about it, by all means, drop a comment. I look forward to hearing from you.